Which patients can benefit from chiropractic care? What evidence and guideline-based decisions can guide referrals? The Virginia Chiropractic Association has produced this presentation to make the process easy and successful. Government and insurance guidelines exist for chiropractic care. The Virginia Workers' Compensation System includes chiropractic care, and on the federal level, Medicare has its own guidelines for chiropractic services, which have been a partially covered benefit since 1972. In deciding when to refer a patient for care, most physicians agree with the determinations of the U.S. Department of Health and Human Services, which recommends that referrals be based on risk-benefit ratios as well as patient preference. According to published literature, your patients are seeing doctors of chiropractic and not just for back pain. The literature on the safety and efficacy of chiropractic care for low back pain, neck pain, headache, and other conditions is considerable and growing. In fact, doctors of chiropractic are trained at treating the vast majority of neuromusculoskeletal conditions using a variety of scientifically accepted methods, inclusive of manipulation, mobilization, soft tissue treatment, and appropriate modalities and rehabilitation. Once you've decided to make a chiropractic referral, or when your patient inquires about chiropractic, what steps do you need to take? Step 1 is to identify a doctor of chiropractic who works well with you and your patients. Your nurses, PAs, colleagues, and staff likely have information on which doctors are the best, and most doctors of chiropractic will be willing to make time to meet you to do an in-service, or just to build rapport, trust, and shared expectations. After you've found the right chiropractor, step 2 is to identify appropriate patients and inappropriate ones. Spinal manipulation is not appropriate in the presence of fractures, tumors, cauda equina syndrome, or osteomyelitis. Though doctors of chiropractic are licensed by Virginia's Board of Medicine and required to perform their own history, examination, and differential diagnosis, it will be helpful for you to rule out contraindications to chiropractic management prior to referring the patient. In cases of cervicothoracic pain or headache management, for example, a chiropractic referral is a supportable and excellent option. In the absence of red flags, you can confidently refer your patient for a trial of chiropractic management. There is no demographic that cannot safely be treated using chiropractic methods. Modern chiropractic pairs appropriate techniques with appropriate patient populations. If you have any patient-specific concerns, please include them on your script. Many insurance plans and Medicare allow direct access to a chiropractor without a referral. Even if the provider you or your patient prefers is not a participating provider, many patients have excellent non-par or out-of-network benefits for chiropractic, and a substantial subset of patients are willing to pay out-of-pocket for exceptional chiropractic services. As with any referral, you will be doing your patient a great service by providing appropriate information, informing him or her of available options, and allowing the patient to make their choice. Once you've made a referral, expect feedback. Doctors of chiropractic may call or may send reports. Chiropractors use standard terminology, and don't be surprised if the chiropractor uses outcomes assessment tools to monitor progress. The doctor of chiropractic is trained to work as part of the healthcare team and will refer the patient back to you for management of the patient's medications or other management outside the chiropractic scope. Thank you so much for taking the time to learn more about how chiropractic can help create a healthier community with your help. We look forward to being part of your healthcare team.